Hi, my name is Jeanette Denny. I'm the nurse manager for the orthopedic unit. I'd like to thank you for taking the time to watch the total joint replacement video. Today, you are going to learn about what is going to be helpful to you before you have your total joint replacement surgery. You will have different segments in this video. One of them will be with rehab therapy. The other one will be with case management, and then with myself for nursing. Before your surgery, you're going to go to pre-surgical testing, and your physician will let you know where that is located. We do have a pre-surgical testing department here at the hospital, and our nurses will help you through the process once you come in, or your doctor will tell you exactly where to go to have your test that you need done before your surgery. You will be given chlorhexidine-based soap. It could either be a gel-like soap like this or some wipey cloths with the chlorhexidine on them. Basically what that is for is to prevent any surgical site infections from occurring. So we ask you that you bathe with the soap the night before in the morning of surgery with a focus on the surgical site area. Please do not get the soap anywhere near your eyes or your face or any areas that are sensitive skin is located. So please just focus on the surgical site area. The day of your surgery, you will be coming in through the Jackson Street entrance. There we have complimentary valet parking for you, and you will be coming up to the second floor. That is our surgical unit. There you will be greeted by an intake coordinator, and they will guide you through the process to get you to your surgical area. We have a surgical waiting area for your family or friends that come in and want to wait for you till after the surgical procedure. Please leave your valuables at home. We will provide you with a gown and also some non-slip socks here in the hospital, so please no jewelry or anything of value here in the hospital.
Occupational therapy is getting you back to taking care of yourself, getting you back to doing the things that you do on a daily basis, like bathing, dressing, grooming, getting in and out of the shower, in and out of the car, all the things that we take for granted on a daily basis. Physical therapy definitely is super important for you for your new joint replacement. Physical therapy will work on walking, balance, leg exercises. So really following what your physical therapist and occupational therapist tell you what to do is really important to get you recovering. Studies show that if you start moving right away, start working right away with therapy, your recovery time is a lot shorter. So it's a great benefit for you to continue to work with us and to do the best you can in your recovery. First thing I will talk about is a knee replacement. Knee replacement, there's a few precautions we want you to keep in mind. The nurses will keep the foot of the bed locked out for you so that you're not tempted to bring your knee up into flexion while you're in bed. We want you to really fight against having a pillow underneath your knee and try to keep your legs straight in bed. We want you to get that full extension in bed because when you're out of bed, you'll work on knee flexion and gravity will help you in getting that knee bending again. So I know it's not comfortable at first, but really try not to put anything behind your knee. It's okay to have a pillow underneath your calf, and that'll promote extension in your knee while you're in bed, but really anything else behind the knee is a no-go. So when you have a hip replacement, many times there are rules you have to follow, and usually there are no crossing your legs, no bending past 90 degrees, and no pigeon toeing. And the reason for these rules is because right now your joint has to the bone has to grow around the joint and kind of stabilize that prosthesis, and your ligaments and tendons need to tighten back up again. And usually this is for about 3 months, so just until everything comes back into place. At this time you are at risk for dislocation. So we want to prevent that any way we can. And in order to help you along with that, we have this abduction pillow, While you're in bed, your legs are on either side of it and they are strapped in. Because when you're sleeping, you don't know what you're doing. You may cross your legs, you cross over the midline, and you could dislocate. So in order to prevent that while you're sleeping, you're going to be in this thing. And again, it straps around your legs, and it's only while you're sleeping, so it's really not that big of an issue. But it's just to remind you not to cross, follow your rules, and promote better healing. On to expectations. We do expect you to get out of bed with us the morning after surgery. Sometimes the day of surgery, that afternoon. It's always better to try to get up with us and try to do as much as you can with us. People do so much better getting out of bed when we first come see them. The ones that kind of put it off and don't want to get up right away, their recovery time is a little bit longer, and that works 100% of the time. So we will be there to try to get you out of bed. We'll try to get you to come sit at the edge of the bed. We will monitor you. We will make sure there's no change in your blood pressure, you don't start sweating. So we will monitor you step by step. If we think things aren't going well, we'll lay you right back down again. So we really want to try to get you up and get you walking, maybe to the chair at least, just to get you upright. There's nothing good about staying in bed. It increases your chances of blood clots, your lungs start filling up with fluid, you can get pneumonia, muscle atrophy sets in a day. Nothing good about staying in bed, so we will nag you to get out of bed. Also, I want you to expect that we will do exercises with you. You will be weak, you will be in pain. The pain medicine is not going to take the pain away. It will just take the edge off. We want you to be alert and able to work with us and work with therapy and be able to get the most out of therapy. If you have too much pain medicine, you're not going to be awake. So we want you to keep going with us and working hard. So on the flip side though, if you feel funny or you feel not right and can't quite put your finger on it, it could be the pain medicine. If you feel itchy, if you feel lightheaded, dizzy, nauseous, we want you to keep all that in mind because that could be the pain medicine. We can talk to the doctor, get him to maybe tweak the level, change the medicine, whatever. Please don't hesitate to talk to your nurse. She can get that changed for you. So, as far as getting your home ready before you have your surgery, that's super important. And we want you to not have a cluttered house. We want you to get all the electrical cords out of the way. Any little pets that you have around, maybe send them to a friend's house, a kennel for a little while, just so they don't get underfoot while you're trying your recovery once you get home. But in addition to those safety things in the house, we want you to make sure that if you're planning on getting grab bars in your shower, you get them done before the surgery. If you want a tub transfer bench to make it easier to get in and out of a tub, get that before the surgery. We will use a rolling walker with you here in the hospital. That has 2 wheels in the front, straight legs in the back, and that is the safest type. We prefer not to use the rolling walkers with the 3 wheels or the 4 wheels. If you forget to set the brakes, they will roll away, you will fall, and you could compromise your new joint. You worked really hard for this new joint, so let's not mess it up. So what I have in front of me now is a CPM. It stands for continuous passive motion, and the key word there is passive. This is moving your leg for you. You are not using your muscles to move it. This does not replace your exercises. This does not replace your therapy. What this is really good for is working on keeping that knee nice and loose and ready for us to work with you. And it's pretty good for pain control, I hear. Some of my patients love it and they sleep in it because they sleep better with it. So again, this does not replace your exercises. So remember, with therapy, you will do your exercises, you will do your walking, you will do your standing and walking through your operative leg. Just remember that a good idea is to maybe start doing the exercises before your surgery too, just to get your knee used to doing exercises. So in addition to using a rolling walker, which again is 2 wheels in the front and straight legs in the back, a lot of hip replacements have been opting to use what we call a total hip kit. It includes adaptive devices to make you completely independent in bathing and dressing. So if you don't want a loved one to dress you and want to be independent and get dressed on your own, it includes a reacher, a sock aid, elastic shoelaces, a long handle shoehorn, a long handle sponge. With this kit, considering your hip precautions, you will be completely independent in bathing and dressing, which is really great for your recovery and to increase your range of motion and just work on things in general with your recovery. If you're planning on going to rehab upon discharge from the hospital, make sure you have clothing that's comfortable for you, loose-fitting, cotton, breathing, a good pair of shoes that hold your feet, whether they're a type of sandal that strap onto your feet safely, a tennis shoe, that's the kind of shoe you want to have. Whichever shoe you pick, you do want to flip them over and check the soles and make sure they're pretty evenly worn. I don't want you to maintain that same walking pattern you had before with your bad knee or your bad hip. We want you to learn to walk correctly and walk and retrain that new knee and those muscles to start working again the right way. So basically, when you come after surgery, you will have therapy, whether it's occupational and physical therapy is probably a big chance. But the key thing is to work with therapy, do the best you can, get the most out of it, have your home prepared before you get home from surgery. That's the most important thing. Wide open walkways. You don't want any obstacles in your way once you get home. So generally, therapy is the best thing for you right now.
Hi there, my name is Carolyn Shackett. I'm a case manager at St. Anthony's Hospital on the 6th floor, which is the orthopedic floor. And my talk to you today is about your discharge plan when you come to the hospital. Your discharge starts as soon as you're admitted to the hospital. Either myself or a social worker will be visiting you on your first post-op day to talk about your discharge plan. Depending on your therapy evaluation, you'll either go home with home health care or you might need to go to a skilled nursing facility. But I will be talking to you about that and talking to you about how many days they allow you to go. If you need to go to an outside facility, the social worker will talk to you about that. And she will usually give you 3 options of places to go, and then you can make your choice according to what your insurance will let you do. It's really important before you come to the hospital and you know you're going to have your knee or your hip surgery, if you contact your insurance company and find out what facilities they're contracted with. And then that way that will go much more smoothly, because when you come to the hospital, your discharge starts as soon as you're admitted. And if you know this ahead of time, it just makes your whole stay run a lot smoother and we don't have any complications when it's time for you to leave. So just remember that me or the social worker will be coming to see you immediately after your surgery on the first post-op day.
Once you're in the surgical center, you will be greeted by an intake coordinator. There you will then meet your nurse. Before having your surgery, your physician, your surgeon will talk to you about the type of anesthesia that you will be having. And then once you're here for your surgery, the anesthesiologist will come and meet with you and discuss that option with you as well. Once you have your surgery has been completed, you will then go to the recovery room area. There, your nurses will be taking care of you, and once you are fully recovered, you will come up to our unit. For pain management, most of our physicians do use patient control analgesic, and that comes in this pump. It's encased in this pump. The type of medication is determined by your physician and your medical conditions, and if you have any allergies or anything like that. This, again, is called a patient control analgesic, and it comes with a button that you press and only you press when you have some pain. There is no way you're going to be able to overdose, so please don't worry about that. Your physician will let us know the actual amount of medication that you can have every hour, and you'll be pressing the button when you have pain. If this doesn't work for you, we can always try other alternatives, and that's a conversation that you will be having with your nurse and with your surgeon. You may have a pain pump administered to you while you're in the recovery room area, or it may be administered up on the surgical orthopedic unit. With that being said, there are several different equipment that you will see after you have your surgical procedure. One of them is a nasal cannula, and the nasal cannula is going to be worn by you right after the surgical procedure. And what it is it supplements you with some oxygen temporarily while you are using a narcotic-based pain reliever, which would be administered through the pain pump. The next thing you'll see is an incentive spirometer. The incentive spirometer basically is to help you expel those gases after anesthesia. It's exercises for your lungs, and what you do is you suck like a straw, and you try to do this 10 times while you're awake. I always tell my patients, you know, do it in between commercials. And again, this is just to help you prevent things like pneumonia and also to expel those anesthesia gases. The next thing you'll see is something called a urinary catheter, and this will be placed during the surgery while you're sleeping, and you may or may not have this. Not all patients get this catheter, and the reason for the use is just to provide you with some comfort while you're in that period of immobility right after surgery. Our goal is to get you up and walking as soon as possible, so this will be removed the day after the surgery if you do have this catheter inserted in surgery. The next piece of equipment is called a sequential compression device, and what this is used for is to prevent blood clots. This wraps around your leg and it inflates and deflates periodically, and again, this is used to prevent blood clots from forming. Your surgeon may order this, or they may order some compression stockings, and those are really tight stockings, socks that you put on, and they're usually either knee-high or thigh-high, and that again is to prevent blood clots. They may also order a medication, an injectable, to prevent blood clots, or it may be a pill form as well. Now the next thing I want to show you is a call light, and the reason I'm showing it to you is because we want you, the nursing staff, needs you to please call us whenever you want to get up and out of bed. We want to do our very best to prevent falls from occurring. After you've had your surgery, you may feel very confident and comfortable and want to get up by yourself, but we want to be there to assist you as much as possible so that we do prevent things like falls. So now that we've talked about the equipment that you will have after your surgical procedure, I want to talk a little bit about what to expect on postoperative day number 0, which is the day of the surgery, postoperative day number 1, the day after the surgery, postoperative day number 2, and then the last day is typically postoperative day number 3. So on the post-op day 0, you will meet your nurse and the nursing assistant. You may meet your case manager that day, depending on how early or how late your surgery is. That day we may get you out of bed. It depends on what your surgeon's orders are. And again, one of our goals is to try to get you up and moving as soon as possible. Postoperative day number 1, you will get out of bed twice with physical therapy, and they will work with you and do some of those exercises that we talked about that you were practicing doing at home. That same day, you will also meet your case manager, and the discharge planning will start at that time. Then postoperative day number 2, again, you will get out of bed twice and you will do therapy in the morning and in the afternoon. Again, when the therapist works with you and does the exercises, the nursing staff will also encourage you to stay out of bed as much as possible. You could sit in the recliner chair, and once you need to get back to bed, the nursing staff will help you back in bed, and we want you to call us and not try to do this on your own, because the last thing we want is a patient fall. We want you to be safe while you're here in the hospital with us. The last day is typically postoperative day number 3. On that day, there should be no surprises. You would have been speaking to the nursing staff, the physical therapy staff, and also the case manager, so you should know on that day where you're going to be going, whether it be home or to a rehab facility or to a skilled nursing facility. And on that day, we will do our best to get you the 2 therapy sessions prior to you leaving the hospital. When it's time to go home, we will make sure that we give you the prescriptions that the doctor left for you. Any information as far as discharge information that the doctor has left for you, the nurses will go over with you. We'd like for you to have your ride set up, and if you don't have a ride, we can set that up for you with our case manager and social worker. On that day, if you are going home, we will make sure we have a wheelchair for you here, and we will wheel you down to the first floor where your ride will be waiting for you, and we will help carry any materials that you have in the room that you need to take with you. If you are going to a different setting other than home, then you will meet a social worker at that setting, and they will guide you through the process once you're there. Nurses will call patients that are going home the day after discharge to make sure that everything went well with your discharge process, and to make sure that you have all the things that we planned and set up for you at home. Thank you again for watching the total joint replacement video. You have seen case management, you have seen rehab therapy, and also nursing. If you have any questions at the end of this video, please remember that you can always call your surgeon and get those questions answered. And when you're here in the hospital, you'll have plenty of opportunities to have questions and answer, whether you're in the pre-op area, post-op area. Those questions will be answered for you at that time. I'd like to thank you again, and you are really on the right path after watching this video to a healthy and a speedy recovery. Thank you.